Family planning, as one of the services that we offer at the primary healthcare level, is a way of ensuring that families are planned. Family planning is not saying don't have children. Family planning is saying have the children you want, but be able to space them. That is what family planning affords the women and families in our community.
Family planning is not about restricting you to a certain number of children, but it's about you planning the number of children you need and making sure that you can feed them, you can comfort them, you can educate them, you can have a one-on-one chat with each and every child of yours.
Family planning is a means of helping women to have children as at when they want to have them.
Before TCI came into Akwa Ibom State, we actually had problems in the family planning space. Why? Because we didn't have so much partners partnering with the state on family planning services, and coordination was somehow an issue for us. And also we had this issue of lack of providers.
Demand generation for family planning in particular had been low before TCI came. That was because there was not much awareness as we have now. There were no people to go into the community to create awareness about the availability of family planning services. Data could speak to it. If you compare the data before TCI and now, you could see that there's much difference.
There were so many myths and misconceptions surrounding family planning. With the coming in of the Challenge Initiative, they have gone a long way to help the states. They started by training community mobilizers, then distributing them across the 10 LGAs that they are supporting to sensitize people, create awareness on family planning service uptake.
We used to have a lot of issues like lack of commodities. There was no awareness creation, enough awareness creation. They came in and we have seen tremendous changes.
TCI has ensured that they train and retrain our staff. There's nothing better than capacity building. They've supported a lot of our outreaches and also what we call in-reach. They've also supported, setting up an advocacy call group, and that is one of the first that we've had in the state, like a formal group.
For now, my understanding has always been that it's a way to really cut down the number of family. My understanding was that the West, quote and unquote, are bringing in methods for us to now reduce our numbers. Until I met the TCI, that enlightened me more.
Before TCI came, we did not really understand the high impact interventions that could, create demand for family planning services. But when TCI came, that technical support gave us more knowledge on high impact interventions, which we have been able to, implement in our facilities and in the state as a whole, and it has really increased our uptake.
Whole site orientation is what I am doing now. Bringing you from the OPD, bringing Ma from CWC, bringing this one from our Safe Motherhood unit, both the staff and non-clinical staff together to talk about family planning.
There are so many impacts. What I noticed when I came here was not what is happening now. Because if you compare the data we had some years ago and the data we are having after TCI have trained us, you see that the number of people that have benefited from this family planning is much.
In the M&A, we were trained and molded to handle data management specifically when there is a support. And on that note, when TCI came in, there was a very great gap because we did not enter and look at how family planning data is. We were just limited to supported programs. So when they came, they really strengthened us in a lot of ways. They started with training the HMIS and the M&A staff. After the training, they now engage us in different dimensions. One of the engagement was in data validation meeting. They engage in data quality assessment, in coaching and supervision, monitoring and supervision as well. Not only to M&A officers alone, they also engage the assistant M&A.
Most importantly, they were able to provide us with books. There's one that we call Family Planning Bible. It is what carries the standard for family planning in the Federation.
A lot have been put in place because, when TCI came, they gave us that impression that we are not here to do everything for you. We are here to create a kind of self-reliance, system that you have to grow and stand all by yourself. And right from the first day they came, we have been working on that. And, system has been put in place for that sustainability.
The aspect of sustainability, it is the place of the state to ensure that they follow up in the good works started by the Challenge Initiative by ensuring that family planning has been given priority.
We have been working seriously with the Challenge Initiative to facilitate the services of our family planning in the state.
When families are planned, you don't have more than what you can feed. You don't have more than what you can train. It also beefs up the quality of our children. There are a lot of benefits for women in particular and the family in general. TCI at the state is closely working with CAN. What CAN has done long before now was to ask us to take this message down to our respective churches.
It was a long process trying to convince them because of what they believed about family planning before. But when TCI came and we were able to do our step down with the materials given to us in order to inform them, I believe they are now more informed.
Twice in a week, we hold seminars, we hold meetings to now showcase and bring some Quranic verses to really show that this issue of family planning is not only good, it's also is highly accepted in Quran.
Family planning, amang wame. Go bidoro bayo made up dami mama. Tonga 2017. Genge mana patra me make aro wodi, which is na yet me na. So tonga inero me ma tonga na family planning to do. Ariki some 2023 keke spa. So min den this no family.
Family planning go be radio night. Even in the tom name. Nka health center ka moge etang yung amin mendiki inam family plan amin yem bikena ma family plan ga manan dito dun inam dito nye kenye nyem fang so ni na ma family plan amin family plan di fon yem it and space mien nin kan nyem fang adi kama mo.
I derive many benefits. Number one, to know how to space a child for maybe 2-3 years before I get another child, and two, to allow us fetch for food for them and to care for their school fee and to allow Mariam to have rest.
TCI has been a positive influence for good for us at the state level. So I commend them, I commend your efforts, I commend all that you do, and I hope one way or the other, even if it's not like this, let there be another iteration of your efforts here at the state level. I look forward to working with you in your business as usual. Thank you.